And welcome back. I was just during the break here talking to our guest, Dr. Chino, about over the years we have heard about a lot of different cancers, and doctors come on, either our show, national shows, prostate cancer, breast cancer, pancreas, things like this. But it seems over the past decade we've heard less and less about lung cancer, correct, doctor?
Yes.
And yet, as you were saying before we got on, it is really one of the leading causes, when it comes to cancer anyway, of deaths in this country. But for some reason, it's not a cancer that is, let me put it this way, popular in the news as it was 20 years ago.
Correct.
So we don't hear about it much anymore.
Correct. The incidence of lung cancer is rising within the last 30 years. I've been in practice in Orange County for that long. 150,000 new cases a year are reported. Currently, we're up to 220,000 a year. Of these, only about 12%, that is a fairly small number, are cured. And the idea now is that we now have a prospects of a newer approach toward this, which is going to be really helpful.
And what do we know about lung cancer today as opposed to what we did 20 years ago? We used to hear, well, lung cancer is caused strictly by smoking. Yes, that's true. However, there's far more other things that can bring on lung cancer. I think maybe about a year or so ago there was somebody in the news, I forget who it was, but they were kind of well known, and they got lung cancer, and they were like, well, we never smoked, we've lived a pretty healthy life. They were pretty young, I think in their 30s, whatever it was. There are other causes of lung cancer.
Correct.
Smoking.
There are a number of occupational exposures, such as asbestos, people that worked in the brake lining replacement work, sheet metal work. People also had exposure to things such as arsenic in mining and other exposures. But I think smoking has always been traditionally the most significant source. More recently, in the last 10 years or more, there are more cases of people in which you have no history of significant exposures who develop lung cancer. And this is a significant group of people, so that if you screen people, as it were, you got to watch out for this group also.
Okay, you mentioned screening, and Saddleback sent along a brochure here that talks about low cost and low dose CT scan. What is that exactly?
What happened was the federal government, about 2002, 2004, funded a study, and the study recruited 26,000 patients that had a history of smoking, 10 years or more, a history of industrial exposure to asbestos, et cetera, and then went on ahead and put them through something called a low-dose CT scan. What is that? The CT has got a certain amount of radiation that patients are exposed to. And in this circumstance, the dose was lowered, and then they took a specific group of parameters that they followed. And they took 26,000 people, and they went on ahead and screened them. Now, about 10 years later, actually, you started getting results. And currently, the overall results from early screening is that you may increase the cure rate of lung cancer by at least 20%. I spoke of 12% as the current cure rate. You may get that up significantly by 20% higher by diagnosing the tumor early.
Yeah, I actually found that very interesting that you said 12%. I think, again, the misconception is by people, well, lung cancer nowadays, that's curable. That was one of the first cancers we started to hear about back in the 1960s. It really came to light, obviously, because of smoking. And by now, it's all cured. If need be, I can get another lung or whatever it might be. But that's, I think, the misconception, isn't it?
Correct. I was basically in the 60s, raised, et cetera. So I recall the physicians were holding cigarettes saying the T-zone is made better by smoking. At any rate, the main thing about it is the fact that nothing has changed in terms of the cure rate since that era. They were curing 12% back in the 60s, and they're curing 12% now. If you don't change the system, as it were, a lot of people are lost. Lung cancer kills more people than the combination of cancers of the breast, prostate, and colon. That is, it is the biggest killer. And yet, little attention is brought to it until this past year when actually 3 papers were printed on this study that was funded by the National Cancer Institute. So those results are what we're talking about now.
And what if cancer is detected?
If they're detected, then basically they get referred. Our approach toward this has been as a group. That is, we have a medical oncologist, a radiation therapist, a thoracic surgical group, and the radiologist, and we'll review all of these studies that are picked up by low-dose CT, and then basically work them up. Our feeling is that the primary physician should be the director where this patient goes for evaluation. If there's any questions, we can do it as a group in terms of evaluating, and then report back to the group to see if we're getting the results we should.
Okay, and I'm looking at a brochure that was given out by Memorial Cancer Institute, and it goes over different areas that you could check off if you are at risk. Just a couple: are you at least 50 years of age? Do you have a history of 20 years or more of smoking? And you go down the list. Do you have a family history of lung cancer? And things that you might have been exposed to, like asbestos, arsenic, cadmium, and chromium, and so on. You know, a couple of those actually stick out in my mind, cadmium and chromium. And I remember several years ago when I worked in an art supply store, cadmium and chromium, at least back then, in very, believe it or not, very good quality oil paints. There was a lot of cadmium red, that's an actual color of it, and there was chromium orange, believe it or not. Now, I think those formulas have been changed, but I remember reading many years ago in the class that I took that for years and years, artists that used these a lot had some exposure. Maybe not a whole lot, but I found that rather surprising. Nobody would think of that if you were, well, I never smoke, but I'm an oil painter.
Well, I think this is true of many items. I'm afraid there are probably other materials in industrial use and actually in the home that probably are significant for lung cancer development. I mentioned that group of people in which you find no history of exposure to the conventional things that cause lung cancer. So it will probably turn out in the future that other items, even your water, for instance, there's asbestos in water apparently, which comes down from the Sierras. So I think other items will come up in the future, but what we have is right now the things that we can work with, and that list that you have in front of you it came out really from the national study, and actually we'll try to duplicate part of that, although again our feeling would be to get out into the major community and treat the people and evaluate them appropriately.
If someone is detected with the low-dose CT scan, what is their percentage of curing this? Does it depend on their age? Someone 30 comes across this and you detect it versus somebody who's much older?
Okay, we'll get the numbers. And if you take the screening CT study, low dose, and you take 100 patients, about 20 of those will require additional workup. And we would say go back to the primary. If they can't figure it out, call us as it were, and we'll get as a group to work the situation up. Of that 20, 1 will turn out to have a cancer. So it's 1% that you're finding. It's a fairly significant number.
Okay. And the CT scans, do they have to go through their primary physician and request one, and then they set that up for them?
What will happen is after the screening study, which is covered by the individual patient, then you fall into the conventional system, and conventional insurance will pick up the follow-up CAT scans and the other studies that you do. So the system's up there already to handle the person that shows up with the tumor. Okay,
but they need to go to a specific place to get these. We've seen, in fact, you talked about this during the break. I don't know if they're still around anymore, but they have these things called full body scans. And I remember actually seeing this one time for a very short amount of time, I think at the Irvine Spectrum. There was an office there, and you used to hear about that probably about 6-7 years ago, these full body scans. Correct. You still hear commercials about that. Is that what you're talking about, or is this different?
No, it turns out that the low-dose CT screening for lung cancer is a very specific piece of machinery and algorithms, as it were, and it's superior to the CTs that were done in the past. The machines have been significantly improved over the last 10 years, and this gives you a much lower dose of radiation. You don't have risk from cancers, et cetera, just from the screening. The second thing, the cost has been reduced to a very low level of $125, which is ridiculously low. So I think, again, it's another level of improvement. It's the way you should be screened in terms of your lung.
Okay. If it is detected again, you are, being that you are a surgeon in this, is the first option to see would be chemotherapy, radiation? What's the first one? And does it depend how much is detected?
Right. The main thing would be this. The cures from lung cancer in the past have just virtually all been surgical, and the cures in the future probably will be the same. What happened in the past is that out of 100 patients, 25 were potentially treatable and were removed surgically. In the future, with the low dose, the prospects are that maybe 50 to 75% of people are going to be treatable. Probably the curable treatment, as of now, will be surgical, but there are new developments in the field.
Okay, and you can call the lung cancer screening program for Saddleback Memorial there. The number's on the screen, 452-3648. And great information, and I think surprising, since as we've both said, you don't hear about lung cancer so much anymore, and yet it is the #1 cause of cancer deaths, and it's quite interesting, and I appreciate you coming on and bringing this to light.
Thank you.
All right, thank you very much. Folks, we'll be right back in just a moment.